Sure, great question. And I always struggle with trying to be concise because you're asking a very long question, which I'd love to talk with you more in depth about how to unpack. So, just in a nutshell, our assertive community treatment program is an intensive program they tend to be the folks that tend to utilize the emergency rooms. They tend to go to the jail more frequently. They tend to be people that are chronically mentally ill. That program has its own phone, which a client can call at any time, and 911 can actually divert to the assertive, sorry, I'm really in the weeds, but the ACT phone, right? So right now, there's an assertive community treatment member, maybe a nurse, maybe a counselor, a mental health professional, but somebody from that team who knows that person really well, knows what their triggers, knows what maybe medications, know what calms them down, know what helps them out. So anybody on the ACT team gets an automatic, divert from law enforcement. During the day, we have a jail diversion program too, and they're expected to the same thing. They're kind of related. They're folks with a serious and persistent mental illness that tend to, unfortunately, commit petty crimes and go to Norcourt, right? They, steal something, or they're urinating, or they're in the wrong place at the wrong time. Again, nonviolent petty crimes. Jail diversion tries to respond to those folks at booking at Norcourt to divert them, or to respond with the officer on the street to say, okay, no, officer, I know, John here, let me talk to John, and then the officer can take off and go about their way, if a citizen called. And then behavioral health crisis. So, not every one of those has to involve law enforcement. So, and many times, law enforcement will consult with the behavioral health crisis worker on call and to say, we develop a kind of a little quadrant grid. So for instance, if it's an unknown person and there's a public safety issue, we don't know anything about this person, but there's there's maybe a weapon, or maybe there's a history, something scary. That's obviously a public safety call. But the other end of the quadrant is, again, one of these folks that we know very well, that law enforcement or 911 knows very well. And law enforcement doesn't have to be involved at all. And those tend to be the lion's share of those kinds of calls, or those, that sort of other quadrant where they are very well known to all of us in terms of law enforcement and behavioral health. Maybe the person just gets overwhelmed or doesn't know how to, they might have some delusions or hallucinations that, cause them to bother or call the police all the time. So that other quadrant is where we try to pick those calls off of law enforcement and not expect a public safety officer to go. And then the other two quadrants about we respond with law enforcement, but then we, depending on the acuity, sorry, I'm way in the weeds and hopefully I'm answering your question, but law enforcement might wait around the corner where there's still, in other words, there might be some semblance of risk. Our crisis worker will take the lead, will stand at the person's threshold of their door and try to come up with a safety plan while law enforcement is still present. And then, if we're concerned about I personally have responded many times where law enforcement, is still present 6, 7, 8 feet away, but I'm having a quiet conversation with the person at their door. Hey, your neighbors are really concerned about you. Your neighbors, you don't want the police here. I don't blame you. But, when you're yelling and screaming and scaring people, of course, they don't know what to do but call the police. So those would be, and then, we do have obviously a crisis worker that works from 7 to 2 a.m. who is, really comfortable at responding to calls on his own. So I'm not sure, again, Commissioner, I'd be happy to, sorry, keep thinking I'm in the county, but counselor, I would really be happy to unpack some of this more. I don't want to take the council's time. I'm sure you'll have a late night, but I tend to get ramped up and want to talk about these things, but hopefully that answered some of your question, at least some of the
and I appreciate your time. I think it's definitely something that as a council, we really need to hear. So please, you're not wasting any.
Okay, good. I want to be mindful of your time.
So my last question, and then anyone else that has a question can jump in. So you just explained a beautiful situation where you were the one who diffused the situation. You had a police officer just in case the situation escalated. What percent of those cases here in Hood River happen where it's you as opposed to a police officer responding?
Boy, again, I'm going to apologize. I don't, and I don't want to just, oh, it's 10%. I really am not sure if I could dignify, and I would hate to steer you. What I'll do is I'll take two pieces takeaway. I will dig into our data much more clearly, and I can give you a percentage. I would say anecdotally, especially Hood River City Police, I would say we get more collaborations with Hood River County Sheriff, frankly. Again, I'm just speaking anecdotally. Whereas, Chief Holste, he has my cell phone number. he can call me at any time, especially if there's a system concern or a consultation or something didn't go right. But it tends to be less frequent with the city police. I would say the county, we tend to probably have more. I'm not sure why that is or what that dynamic is, you know.